rural Australians continue to be disadvantaged by the chronic shortage and maldistribution of doctors. This has resulted in reduced access to health services and requiring people to travel to obtain medical care. It has also led to poorer health outcomes, higher rates of otherwise preventable illness and hospitalizations, and shorter life expectancy for rural people compared to those in major cities. The Rural Clinical Schools program, run by various universities in Australia, including the Australian National University, helps to alleviate the shortage of rural doctors. By allowing medical students to experience extended placements in regional and rural locations, it has influenced around a quarter of rural clinical school graduates to practice rural medicine. The remaining 75%, however, do not return to the bush. Hello, my name is Gizelle Cano. I am a medical student at the Australian National University and the lead author of the research, Why Do Some Medical Graduates Lose Their Intention to Practice Rurally? My team members included Suzanne Bain-Donoghue and Associate Professor Malcolm Moore. Each year, around 25 third-year ANU medical students complete a full year of clinical training in rural towns, known as the Rural Stream. Tracking of ANU Rural Stream graduates from 2006 to 2016 revealed that 80% of them have an increased intention or interest to practice rurally. However, almost 1 in 5 of the participants expressed a change of intention from rural to urban work location at some stage after completing their Rural Stream term. The research team then investigated what factors could have led to this change. To do this, we conducted 10 in-depth semi-structured interviews. But what is unique about this study is that we utilized 2 methods of qualitative analysis, namely thematic analysis and a modified version of iPoems, which enabled us to capture different yet complementing perspectives of the data. For more details on how this was done, you can reference our paper. We found that the reasons why some rural clinical school graduates lose their intention to practice rurally are multifactorial, complex, and volatile. The participants believe that postgraduate rural training is of lower quality compared to that in larger cities, that there are limited opportunities for career growth, and that work-life balance in rural locations is difficult to achieve. Another major factor is perceived and experienced feelings of isolation, both socially and professionally. The desires and job opportunities of the participants' partners also had a strong influence. The participants were committed to both their careers and partners, and therefore may struggle to find balance between their career goals and the needs and the desires of their partners. This then leads to uncertainty of their future practice location. Therefore, when trying to decide whether to stay or work rural, ANU Medical School Rural Stream graduates' career intentions are not completely decided, and there are opportunities to motivate these doctors to return or to stay in rural towns. It is then crucial to recognize and rectify the factors that drive them away from rural practice. In particular, future policies must address the demand for increased and better quality training in rural areas. It is also important to ensure that rural doctors have pathways for career progression and access to adequate locum relief, continuing professional education, mentoring programs, and support from colleagues. Members of local communities can help in overcoming social isolation by demonstrating hospitality, accommodating doctors' special interests, and assisting with their children's schooling. Transparency around job availabilities in regional and remote Australia for dual career couples may allow partners of medical trainees to develop their career path and can offer greater ongoing certainty. We believe that well-designed, more efficient rural health strategies can ensure the positive effects of rural clinical schools remain long-term, with the ultimate goal of redistributing the health workforce into rural areas, improving rural communities' health care access and overall health.